is Don Howell with Abundant Life, and we're going to talk a little bit about broadcasting. So we're going to cover what is a broadcast, who gets them, how to accept and reject them, and a few reminders and tips about broadcasts. Okay, so first, what is a broadcast? It's an open or uncovered shift that is offered to you via text, email, and through eRSP. It will only be offered to the staff who are both qualified, available, and matched. And we'll cover all of that. Broadcasts are sent to the staff via the methods we just mentioned, and they can either accept them or reject them. However, accepting them comes on a first-come, first-served basis. So whoever gets it first is awarded the broadcast. Okay, broadcasts are always optional. You do not have to accept them if you do not want to work. These are extra shifts. These, of course, have nothing to do and will never affect your regularly scheduled shifts. But the benefit, other than the extra work, is that you will gain experience with different patients. So you can see different care settings. You can see different procedures, see different routines and conditions. Okay. Who gets broadcasts? Broadcasts will go to the appropriate staff member. So if it's a nursing case, it will go to a nurse. If it's a home health aide case, it will go to a home health aide. We also factor in a number of things, including your level of experience with trachs, vents, diabetes, etc. For the aide cases, the type of care needed and level of experience is considered there too. Only staff who are available will receive a broadcast. If you're working somewhere else, or if you've indicated to us that you'll be unavailable, then you will not receive a broadcast. You can see our other video about availability and how to update your availability. Okay, and distance. We will not send you a broadcast if you are 2 counties away. We even went a little bit further, and we matched you all with the patients. So if you have an allergy to cats or dogs, we will not send you a broadcast of that case. If you've indicated that you don't want to work around a house full of children, or if you can't do any lifting, you will not receive a broadcast of that case. Okay, so now we're going to review how to accept the broadcasts. Okay, so broadcasts will be sent to you via the 3 methods that I mentioned earlier: text message, email, and through eRSP. Coming soon, there's going to be an app, and it will be released soon that will push notifications for broadcasts and take the place of text messages now, but I'll get into that later in the video. Every broadcast will have the following information: patient name, the date of the assignment, the times, the duration, the location, and the skills needed. So if it's a trach, vent, G-tube, J-tube, or if it's a home health aide case, what kind of care is needed. All that will be included before, and you'll know that before you either accept or reject the broadcast. Okay, just as a reminder, broadcasts are first come, first serve. If someone accepts the broadcast before you, then they are awarded the shift. However, in eRSP, if you see a broadcast in your broadcast, which we'll cover that in eRSP, you can always try to accept it, even if it's days after you've seen the notification. Okay, once you do accept a broadcast, and it is accepted, which we'll look at how to make sure of that, you're expected to treat it just like your shift. So you've essentially accepted the assignment. So if something happens and you can't make it, or you have an emergency, call the on-call nurse immediately. Okay, so if you do accept a broadcast and it is awarded to you, you will be notified, but also it will go right on your calendar. We can see here on this calendar the shift outlined in red is a broadcasted shift, and it goes automatically to the calendar no matter what time of day or night. No coordination or communication with the office needed. If you accept a broadcast, it will go right on your schedule, and you can just go do it. Okay. Let's take a look at the way text messages look for broadcast. You'll receive a text message. It will always be from a random number, and this will be the information that you receive. Usually it will have the city in there too. So here's the date, the time, and it's telling you either to reply yes, Y, or in. Also, the information about the skills needed are in here too. So we don't require and won't ask of you to reject or reply in if you don't want to, but it would help us to know if you would reply in or reject the broadcast. That way we know that you can't or are not willing to make it. Okay? But if you do want to pick up the shift, you can reply with a Y, and that will prompt the system to see if the shift is still available and award you the broadcast. eRSP will notify you with the status of the broadcast to see if you got the shift. Okay? If you look on here are two examples of text messages, both when you're awarded the broadcast and when somebody else is. So in this instance here on the right, you were awarded the broadcast that you replied Y to, and you receive a text message as a confirmation letting you know the broadcast is accepted, the date, and the time. Okay, conversely, over here on the left-hand side, if somebody else was awarded the broadcast because they responded before you did, it will return a message that says visit unavailable. Okay, and of course it'll have the date and time. If you really want to pick something up on that day, you can always give us a call at the office and let us know, and we can see what we can do for you. But as far as broadcast goes, this broadcast is now somebody else's shift. Okay? Again, if you accept the broadcast and you're awarded the broadcast, you can always check your schedule and see if that shift is there. Okay, another method that eRSP will send simultaneously with a text message is an email. Here's an example of an email that eRSP will send regarding a broadcast. Your email address will be here, and here's all the pertinent information. Patient name, date, time, duration, location, etc. Okay. Again, with this, you would just reply either the Y, or you can put yes to accept, or in or no to decline it. Okay. eRSP will, of course, notify you, and this is what it looks like. So again, here on the right-hand side, we have where the broadcast was awarded to you. You responded Y, and eRSP will let you know that the broadcast is accepted through email. Here's the date and the time. Again, conversely, if you do not, or you are not awarded the broadcast, then eRSP will notify you that it is unavailable. Okay, and then once again, if you do accept the broadcast, you can always check your schedule to see if the visit is there. Okay, another way to check broadcasts, or to choose between many broadcasts, or to see what broadcasts are still available, is to log into eRSP, either in the full site or the mobile site. We're going to look at the full site first. Up in the top right-hand corner of your home page, you can click on this broadcasts. Okay, and when we open that window, here's an example where there's still a broadcast remaining. Again, first come, first served, so if you want to accept it, you would check the box and submit. Here's all the information. However, if you log in and the broadcast is unavailable, then you will see that there are no broadcasts available. Okay, Once again, if you do accept the broadcast, it will be on your schedule, so no worries. Okay, we're going to take a quick look at the mobile site and how that functions. It's the same way. You would go log into the mobile site, click on broadcasts. Okay, and here's an example of how a broadcast will look in the mobile site. Again, it usually will have the city here too. Okay, so here's a 7-year-old vent trach G-tube, diabetes mellitus in Clearwater. Okay, of course you can either accept or reject it, and of course the same rules apply. Okay, if you do not receive it, or if there are not any broadcasts by the time you check it, then it will let you know that there are no broadcasts available. Once again, if you do accept it and it is awarded to you, it will be on your schedule. Okay, I'm going to talk a little bit about the app. We're very excited. We heard news that they will be releasing an app that should handle both broadcasts and messages and probably eventually everything that we do in eRSP. But the great thing about it is that it can push notifications. So messages and broadcasts will kind of show up as a notification on your phone. Important to note, and we'll go over that when the app does come out, that it will replace text message communication when you use the app. So we're looking forward to it probably by the end of spring. So here in just a few weeks from the making of this video, and we're pretty excited about that. Okay, here's just a couple reminders and tips about eRSP and broadcasts. Again, they are first come, first serve. So if you want the shift, try to respond as quickly as possible. But even if you don't respond quickly and you decide later to take the shift, you can always try later to see if it's still available. Okay. Again, if and when you accept it, it is your shift, so you have to treat it just like any regular shift. If for some reason you can't make it, something happens, you have an emergency, please call the on-call nurse as soon as you know, as soon as possible. Okay? Once again, and for the last time I promise, it is on your schedule if you accept and are awarded a broadcast visit. Okay? And again, if you log in eRSP and see a broadcast and you want to pick it up, please give it a shot and try. If you log in and it's still there, chances are it's open. So definitely try it. Okay. Of course, if you need any help, you can always send us a message. Always. You can always call the office. You can always feel free to give us a call. We're here to help you any way we can. If you see a broadcast for a certain day and you missed it and you still want to try to pick something up, call the office. It can, it certainly can't hurt. Make sure that your availability is updated. Like I said, see the video about that. And good luck. Thank you. Thank you very much.